Today I'm giving out letter grades for plantar fasciitis treatment. So the first intervention that gets an A grade is stretching. This is stretching of the calf muscles, the plantar fascia, all that's good stuff with plantar fasciitis. The next intervention that gets an A grade is taping. And this is an anti-pronation taping, like an anti-pronation Lodi taping. Taping's great because it can coincide with an intervention that I'm going to talk about in a little bit. Next is night splints. Night splints are typically a boot that you wear while you're asleep that holds your foot in dorsiflexion the entire time while you're sleeping. Night splints are bulky and they kind of suck to sleep with, but they can be really effective for a 1 to 3 month trial for people with plantar fasciitis. So I usually tell my patients, try and suck it up, it's probably going to work. Next are foot orthoses, and this is where taping ties in that I mentioned before. If someone responds positively to an anti-pronation Lodi type taping, then there's a good chance that they'll respond positively to a foot orthosis. And this is really nice because it doesn't seem to matter if it's an over-the-counter orthosis or a custom expensive orthotic. So if someone responds well to taping, I'll usually tell them to try an over-the-counter foot orthotic rather than getting a really expensive custom one. Next intervention we're going to grade is dry needling, and that also gets a B grade. Dry needling more recently has been shown to be pretty beneficial for people with plantar fasciitis. So if you're certified in it, you could give it a try. So we're going to circle back to A letter grades here, and ultrasound gets an A letter grade in the treatment of plantar fasciitis. But it's in red and it has an A letter grade because there is really strong evidence to not use ultrasound in people with plantar fasciitis. The way the clinical practice guidelines grade their treatment can get a little confusing. They don't give out Fs to bad treatments. They give out A letter grades to anything that has really strong evidence for or against that thing. They give an A letter grade against the use of ultrasound in people with plantar fasciitis. So if someone ever comes in asking for ultrasound on their foot for their plantar fasciitis, I will just try my best to explain to them how it probably won't work.